Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give you an update on the COVID figures for New South Wales for Monday the 15th of November 2021. There were 165 new COVID cases reported in New South Wales in the 24 hours to 8 o'clock last night. There were more than 50,000 COVID tests reported in New South Wales in the same period. In terms of vaccination, there are now 94.2% of people aged 16 years and over who've had one dose of vaccine, and 91.1% of people who are fully vaccinated. In the 12 to 15-year-old age group, 80.6% have received their first dose, and 73.4% are now fully vaccinated. In terms of deaths, we're sadly reporting the death of one person today, a woman in her 80s who died at Prince Alfred Hospital. She was a resident of the Presbyterian Aged Care Nursing Home at Ashfield in Sydney's inner west, where she acquired her infection. She had received 2 doses of COVID vaccine and had underlying health conditions, and we'd like to express our sincere condolences to the family and loved ones of this woman who died. In terms of hospitalisations, there are currently 216 patients who have been diagnosed with COVID in New South Wales hospitals, with 32 people in intensive care, 15 of whom require ventilation. Of the people in ICU, 24 have not been vaccinated, 4 have received 1 dose of vaccine, and 4 have received 2 doses of COVID vaccine. So from today, New South Wales Health will be changing the way it reports the COVID-19 cases. Will no longer provide a breakdown of locally acquired and overseas acquired cases in the daily updates, but instead provide a total of all cases. This is because since the introduction of the quarantine-free international travel for fully vaccinated people, the origins of where each case was acquired can no longer be determined immediately, and so it's not possible to accurately report overseas cases on a daily basis. The breakdown of locally acquired and overseas acquired cases will now be reported in our weekly epidemiologic report, which is available on the website. Fully vaccinated international arrivals must comply with the New South Wales Health guidelines, including requirements relating to testing and restrictions from attending certain high-risk places. They are required to have a COVID PCR test within the first 24 hours of arrival, and also on or after day 7. Children and those with medical contraindications who are not fully vaccinated require similar testing measures and should have a further test on day 12 after arrival. And until a negative test result is received on or after day 7, international arrivals are unable to enter high-risk settings such as aged care, disability care, health care and correctional facilities. And not following these guidelines puts the rest of the community, your family and friends at risk, and it's also a criminal offence and attracts heavy penalties. So please make sure you're aware of what testing and requirements you have in terms of restrictions and follow them so that we're keeping the community safe. All travellers should of course practice social distancing, wear a mask when indoors in public spaces, and practice good hand hygiene, especially in the first 7 days after arrival. They must continue to be vigilant for symptoms of COVID and must immediately get tested for COVID and isolate until you receive a negative result should you develop symptoms. If you get symptoms, it's important to have a PCR test for one of the clinics. In the context of our very highly vaccinated community now, from today, New South Wales Health will no longer routinely list case locations for regional and rural New South Wales on the website. This minor change does not affect New South Wales Health's contact tracing work or its response to cases and outbreaks in regional and rural New South Wales. New South Wales will continue to contact people diagnosed with COVID-19 and their close contacts, and all people who need to follow special health advice. If you receive a message from New South Wales Health, it's important to follow the advice in that message. People who've been to a venue around the same time as a person with COVID-19 will also continue to receive an alert from Service New South Wales. And New South Wales Health will continue to support workplaces and other locations where there are potential for outbreaks of COVID. This minor change has already been made several weeks ago, for case locations in Greater Sydney, including the Central Coast, Wollongong and Shell Harbour, and the Nepean Blue Mountains. And New South Wales Health will continue to notify the public of venues of concern where there have been high levels of transmission and there is a need to alert members of the community who may have been there during an exposure period. So thanks very much everyone for coming forward, for getting tested if you have even the mildest of symptoms, and importantly getting vaccinated. And don't forget to get your second dose if you haven't had it yet and you're due for it, and if it's been more than 6 months since your first dose, getting a booster shot. Thanks very much.